Hey everyone, thanks for joining us today. Today's topic are non-surgical alternatives to facelifts. Really appreciate all the questions. They're awesome. Sorry if we can't get to all of them. Um, if you enjoy our videos, please give us a thumbs up and certainly subscribe to our channel so you can stay up on what's new, what's newest, what's recommended in the field of cosmetic medicine. So again, today we're talking about non-surgical alternatives to facelifts. Facelifts, when they're indicated and when they're desired, are wonderful. But as time goes on, less and less people want surgery. Less and less people want the stigma surgery. Less and less people want the scars of surgery. Less and less people want the expense and the downtime of surgery. Doesn't mean they're a bad thing when they're indicated, and certainly they should be considered. But our community of aesthetic people out there desire it less over time. So let's start with the first question.
So Tony from White Plains asked, my neck and along my jawline is really starting to sag. I want to do something that will make me look younger, but I don't want the guys at my work to know that I've had something done. I definitely don't want surgery. What are my options?
Great questions, Tony. So males are becoming a very important part of the aesthetic revolution, the aesthetic discipline. And it used to be rare to see a guy in practice, and now it's actually very, very common. And guys do all the same things that women do, but there are some differences. And one of them, we still want a woman to look like nothing has happened, and we want a woman to leave the office and do so in a way that they can re-enter their life and again, not have anyone know they've done anything. With males, it's even more important. They generally are going right back to the workplace, if we can generalize, and they are really concerned that someone's going to know that something has been done aesthetically. So we're sensitive to that, and we address it in our approaches, in our treatments, and our discussions. So when males start to sag, we look at them a little bit differently than females because their skin tends to be thicker, tends to be heavier. So some of the really conservative things that may work for female may not work for male. Some of the radio frequency or ultrasound devices, for example, may be better for women than men. We can deliver energy from the outside, or we can deliver energy from the inside. If we deliver it from the inside, it tends to be a bit more potent, a little stronger. An example of that would be Thermitite, where we're delivering energy to make the skin contract, and we're doing that from the inside, underneath the skin. Very rapid recovery, very predictable result. So that's a great thing for guys. The other thing, very often a guy will go and push exercise, will push their cardio, will push their diet in such a way that they lose weight. And part of the places they lose weight is in the face. And when they lose weight in the face, things tend to droop. So with conservative use of dermal fillers, we can actually relift the facial contours. Not necessarily make the cheeks bigger, but just lift around the bone, and that helps the lower face. So there are many different approaches. Again, some may be injectable, some may be technology, and we love to sit down and look at specifically what's causing those issues so we can give patients great recommendations. But we can do so in a either non-invasive way, with no downtime, a minimally invasive way with a few days of downtime, and again, when someone desires surgery, that's something we can arrange as well.
Magdelena from Bridgewater wants to know, what are the best non-surgical facelift options for today?
So thanks, Magdalena. And with women, often their skin tends to be a bit thinner. So we can use non-invasive therapies that use ultrasound. Example would be Ulthera, would be radio frequency. An example of that would be Exelis. We may use technology that delivers energy to the surface of the skin, what we call resurfacing devices that actually can improve the quality of the skin as well as tighten. So it really depends on what the issue is. And again, these treatments can be provided non-surgically or can be provided with minimal to no downtime. Again, women like guys sometimes lose fat in their face. A, genetically, it's just they're predisposed to that, or B, through training, through exercise, through weight loss, through diet. So gently putting some of that lost volume back in the face can lift things and give a non-surgical facelift.
So Maria from Somerset asked, What's a vampire facelift, and how is it different from a liquid facelift?
Great question. So vampire facelift was a terminology and a procedure that came out about a decade ago, and it basically just used platelet-rich plasma from the body. What platelet-rich plasma is drawing blood from the patient right when they're in the office and segregating out the platelets, part of the blood that are responsible for wound healing and different kinds of positive things from an anti-aging standpoint. So once you segregate those components out, you're able to re-inject them into the skin. Well, what we found out was that wasn't all that effective. So just taking platelet-rich plasma and injecting it, the result was not all that wonderful, and it created a good amount of downtime. We know now that we have to do that in combination with something else. We have to create some kind of mild injury, such as using a laser or microneedling or radiofrequency with microneedling, sometimes even with a dermal filler. But we have to do something with that platelet-rich plasma to make that platelet-rich plasma, or PRP, act better. So we don't really just inject platelet-rich plasma without doing something else at the same time. So it's come a long way, and platelet-rich plasma, which 10 years ago was suspect in whether it did anything, now study after study after study proves its ability to help us age and look better.
So the difference between that and a regular liquid facelift?
So a regular facelift, a regular liquid facelift means using fillers, dermal fillers, to create a change, either a lift or new contours or improved contours. So a liquid facelift means using generally a good amount of dermal fillers to create changes in our aesthetic, where a vampire facelift meant injecting platelet-rich plasma with and without these dermal fillers, but it started out without the dermal fillers to try to achieve change. Great question.
So Stacy from Berkley Heights asked, my daughter is getting married in just a few weeks, and I want to look good in all of the photos. What can I do?
It's a great question. So one of the most common reasons, and I'm getting nervous here because Alex, who was asking me the questions, is how many months pregnant?
8.
And she keeps on rubbing her tummy here, and I'm getting really nervous. So if I start talking faster here, I'm not trying to cut this short. I'm just afraid that we're going to be delivering a baby here any minute now.
All good.
Okay. What was the question?
That her daughter's getting married.
Oh, right.
Yeah,
Congratulations.
Few weeks.
Congratulations.
What can she do to look better in pictures?
So people come in very commonly for a big event. That may be a wedding. That may be why is the camera shaking now? I think we're even shaking. I think I made Alex nervous. So people come in for a variety of reasons, but reunions, graduations, weddings, big days, big events are sometimes the catalyst for someone to come in. And here we want to make sure we're not making someone look different. We're just helping them make more youthful, more confident, giving them a glow. Sometimes we talk about doing this as making them red carpet ready. So we're not trying to do things that create a lot of downtime. We're not trying to do things that will take weeks and months to achieve a result. So one of the really popular things today is called microrejuvenation. Microrejuvenation involves injections of tiny amounts of hyaluronic acid in the form of dermal filler underneath the skin, and oftentimes that's mixed with tiny amounts of Botox under the skin. So this is not like doing a traditional dermal filler injection if we're trying to lift the cheek or the fold or anything like that. And it's not a Botox or Dysport injection where we're trying to slow down a muscle. Both of these things together cause a glow in the skin. They can help fine lines. They can help pores. They just improve the quality of that skin, and they're something that can lead to just instant rejuvenation. So it's very popular today. There are also very conservative lasers like Clear and Brilliant that are done where someone really doesn't have any downtime and they just develop this glow, something that you almost, when women are pregnant, you notice they have a glow. Well, that's high amount of estrogen and high amount of collagen synthesis in the body, collagen development. Well, these devices can do that. They cause an incredible boost in that collagen. and people just look rested, they look refreshed. Certainly the use of dermal fillers and Botox and Dysport can be done as well as they're indicated, and sometimes we're doing very gentle peels and other things. So we really look at the person and see what's going to make a difference aesthetically, and most importantly, what's going to make a difference in how they feel. All right, we may want to slow down some of those muscles so during the photos there's not as many lines. We may again want to just make that skin just reflect light differently. It's really more about how you feel approaching that big day, and it's just exciting for us to participate and to be a partner in that process.
I know you can use threads too, correct?
Yeah, the PDO threads are something that came over from Europe years ago. A number of them are now FDA approved, and they are things that can give a lift, sometimes for the lower face, and sometimes we use them to generate collagen. So there are many different forms of them. Some of them, unfortunately, require more recovery than someone would want coming up to a big day, but they're, depending on how much time we have at our disposal, they're things that we use. We also, coming back to one of the previous questions, there are also things that can be used as facelift alternatives. Again, there's different methods. There's the Mint Lift, there's the Nova Threads, there's the InstaLift by Silhouette InstaLift. There's many different types, so it's something that we want to specifically evaluate a patient's needs and give recommendations based on those.
Awesome. So Sanjeet from Summit, she would like to know, is Ulthera safe for someone of Indian descent?
That is a great question. So lasers and technology have to be tailored to the skin type of the individual. So we all have different skin type. The darker the skin type, the more concerned we have to be about what we use. So lasers have different wavelengths, and some of those wavelengths are safe for dark skin, some are very unsafe. And one of the most common reasons to see complications out there is that a practitioner only has limited technology. So they're using a laser which is not safe for that person that's in the exam chair. That person may be of Indian descent, have dark skin, and be approached with a laser that's only safe for light skin. What the result, unfortunately, is uncommonly is a complication. Okay, and those are completely avoidable. And one of the ways of avoiding complications with skin tightening are using devices that are colorblind. Ultrasound and radio frequency are devices that where their energy is not absorbed by pigment in the skin. So we may treat someone that is African American. We may treat someone that has olive complexion, both safely and effectively. So it's very important, if you have darker skin, the first question you should ask a practitioner, is this device safe for me? And do your research ahead of time and seek care from physicians and practitioners that have multiple choices, so you're not subject to a decision about one device. So when we sit with someone, I may look at 5 or 6 different devices that can all tighten their skin, but we look at what's the device we want to pick that is going to be the safest and most effective. Great question. Thank you.
Those were the questions for today.
Thank you so much. I really appreciate all the information you guys are asking, and that you guys are enjoying the information excuse me, the information that hopefully we're delivering. So keep the questions coming, and hopefully Alex will be back next week to host again. If not, we might be doing this from the hospital bed. So
hopefully
thanks.
I'll be here.
Thanks, guys.